Addressing female causes of infertility. Now, for us to understand it better, I'm going to use the picture of the female reproductive tract for people to understand. Now, when we use that, the important organs in the female reproductive tract, we have the ovaries. Every woman has a pair of ovaries. We have the fallopian tube, and fallopian tube is very popular. You know, when women are talking, they always tell my fallopian tube is blocked, and every woman also has a pair. Then we have the womb, medically referred to as the uterus. Then we have the vaginal canal. Now, all these have important roles they play in the reproduction of the woman. Now, if there's a problem with the ovary,
can we have a picture of that so that people can understand, you know, let's look at the fallopian tube of the
ovaries and all the other organs.
Of the woman, Now,
the primary function of the ovary is to produce egg, and the ovary also produce important sexual hormones that regulate the reproductive cycle of the woman. Now, anything that tamper with the ability of the ovary to ovulate on a monthly basis can result to infertility. Because if there is no egg, even if there are 100 million sperm, there will be no baby. So there are some conditions that can affect the ovulation of the woman. And most of these conditions are usually from the upper center. When we talk about the upper center, that's the brain. The way God designed our body, most things in our body are controlled centrally from the brain. So there are some hormones that are also produced from the brain that control on a monthly basis how the ovaries of a woman produce hormones and produce egg. Now, a common condition that affects the ability of women to ovulate is what we call hyperprolactinemia. I'm going to break it down so that I was going to ask that. We are not going to speak big medical terms. There's an hormone that regulates how women produce milk and breast milk, even when they are breastfeeding or during pregnancy. We call it prolactin. It should be on a normal level. Ideally, if the woman is not pregnant or lactating, the woman should not be producing breast milk or water. But there are instances, and it's quite common, that women will have breast milk and water coming from their breast. It is not cancer, provided it's not blood stain or producing some other funny colored discharge. But that by itself may indicate that the prolactin level may be high. And prolactin has a way of suppressing the ovary from ovulating. That's the mechanism by which, you know, women, when they are breastfeeding, a lot of them don't menstruate, they don't ovulate, and some, not all, they don't get pregnant. It's the same mechanism. So that hormone can suppress the ovary from producing egg, and by extension, the woman will not ovulate and will not get pregnant. I've had a couple of patients that was the only thing I needed to treat, and they conceived. Now, there's also another common challenge, reproductive challenge in young ladies and women, PCOS, and PCOS is very common. PCOS simply means polycystic ovarian syndrome. Now, what PCOS is all about is an hormonal disorder. You know, in late-term language, they will say hormonal imbalance. But hormonal imbalance is not really a diagnosis, it's not a technical term. But for people to understand what I'm saying. Now, people that have PCOS, they have a combination of a lot of challenges. They don't menstruate on a regular basis. Some even menstruate as scantily as 2 to 3 times a year. Wow. They don't ovulate regularly. And some of them, the male hormones in them may be higher than normal. You know, even women have male hormone, but it's in very low quantity. Right. But in women that have PCOS, the male hormone, testosterone, and some other might be high. And this has a way, generally, of preventing the ovary from ovulating. And when we also do scan, we see multiple small cysts in their ovaries. These are the 3 conditions we usually use to diagnose that. PCOS is also common, is a common condition that prevents women from ovulating. Now, those are about female causes of infertility that has to do with the ovaries. These are treatable conditions if they seek help on time. Now, moving on to the fallopian tubes. Fallopian tubes, they are just a pair of small pipes. God is a master designer. God is a plumber, is an engineer, is everything. Now, the fallopian tube is the conduit through which the sperm and the egg meet. Fertilization, which is the process by which the egg and the ovary come together to form a baby. We all remember our secondary school biology. Occurs inside the fallopian tube. So it's after the fertilization has occurred that the embryo, that's the newly formed baby, the brand new baby, will now migrate to the womb to implant and start growing. So anything that blocks the fallopian tube or anything that makes the fallopian tube to be absent automatically means there will be no conception. And there are common causes. I always advise young ladies, those who are, you know, when the Bible says that the commandment of God are not grievous, it's for our own good. Now, the commonest cause of fallopian tube blockage is sexually transmitted disease, infections. PID, pelvic inflammatory disease. PID is also predominantly sexually transmitted. Okay. From gonorrhea, chlamydia. These are the STDs. Yes, there is the commonest cause of fallopian tube blockage. And when fallopian, so when you are chaste, you maintain moral chastity. You don't, you know, these days, young ladies, a lot of our youths, they talk about body counts. And when they're talking about how many patterns have you had, in essence, they are indirectly eating their reproductive feature ahead of time. Because when they contract STDs, it can block their fallopian tubes. There are some other common other causes of fallopian tube blockage. It can also arise from any other infection that affects the abdominal cavity. Maybe somebody that happened to do surgery and is now complicated by infection, or even surgery itself can also cause scars. You know, anywhere, the way our body functions, when there is a wound, the body heals by forming scar.
Right.
There are some occasions that scar can also affect the integrity of the fallopian tubes, causing blockage. And this can now lead to infertility. Now, to the womb. You know, the womb is the receptacle through which the baby grows. After the baby has been fertilized or the fallopian tube, it migrates down to the womb, the baby implant there and start growing. Now, some things can also affect the womb that can affect fertility. Now, let me quickly talk about the commonest one, which is the fibroid. Now, and I want to emphasize here that fibroid is not a direct cause of infertility. There are millions of women who have fibroid, even big, have several claims, and they have their babies. But there are some instances that fibroid can contribute to infertility. The common analogy I usually use is that bushy environment. You know, when you are living in a bushy environment, your house is surrounded by bushes. No, bush does not cause malaria. But it provides a conducive environment for mosquitoes to breed.
Yeah.
And when mosquitoes breed, readily they can bite the person and they can have malaria. That's, in some women, that's what fibroid does. It provides that conducive environment for something to happen for fertility to be impaired. Okay. For instance, there are some wicked fibroids that go and sit at the entrance of the fallopian tube. If you look at the picture that I've displayed, okay, there is, you see the point at which fallopian tube enter the womb. All right. Some fibroid will sit at that point.
In that picture, I wish they can just display.
Some fibroid will sit at that location and block the fallopian tube. So in some instances, that can contribute to infertility. And there are several symptoms that women with fibroid have. Fibroid itself is another topic, and I will just briefly talk about it. Okay. Now, some women that have fibroid, they'll be bleeding some bleed throughout the month. And when the woman is bleeding throughout the month, when we have coitus with the husband, when we have sex, some women, because of excessive bleeding from fibroid, they find it difficult to have regular sex with their husband. Some have intractable pain. Fibroid can also cause pain. So when they have regular pain on the monthly, a very caring man too, that will not be time to be saying, my dear, let's go to the bedroom. So, and when there is no regular sex, there will be no pregnancy. You know, indirectly, it's impairing fertility. Right. And as a way fibroid itself distorts the lining, the inside of the womb, where baby should implant. So by this, it can also impair the ability of the fertilized embryo to implant on the womb. So these are some of the ways by which fibroid can impair infertility. But fibroid by itself is not a direct cause of infertility. So these are some of the common and pronounced female causes of infertility.